get good music today. This is great. All right, you guys, there's a treatment called Airrosti, and this concept deals with healing the tissue around an injury. So if you have back pain or other problems, this process can make a huge difference, even after 3 visits. Dr. Joey Lowry is here to tell us more. How are you guys?
I'm great. Thank you for having us.
Good. Okay, now I do have back pain. I have scoliosis.
Okay.
And so every once in a while I have some issues, maybe back pain from working out. So tell me a little bit about this.
Okay, well, first and foremost, the common question about Airrosti is, what is Airrosti? And
Sure.
Airrosti is a big acronym. It stands for the Applied Integration for the Rapid Recovery of Soft Tissue Injuries. So we try to get people better as fast as possible, obviously.
Sure.
And what we do is specifically focus on the soft tissue known as fascia. Now, fascia, in a nutshell, is the glue that holds us together underneath our skin.
Sure.
The plus side to it, if we didn't have that component to our soft tissue, we would be injuring things left and right. But the downside to it, it doesn't have much of a blood supply. So when you have a compromise in the fascial tissue underneath the skin there, it stays injured. So that's where I come in, or as well as the other providers do. We first and foremost do manual therapy based off of, after an examination and assessment, the body will tell us where we need to work on. Then we complement that with our rehab exercises, and based off of our treatment model, we're able to resolve these injuries in as little as 3 visits.
So is this something that's just for injuries, or can it be used to help chronic conditions?
It is. Chronic, acute, we get anything from your weekend warrior to somebody stuck at the desk to CrossFitters to
Sure.
professional athletes. So even on our website we have many, many testimonials from various athletic groups, as well as just your
Awesome.
everyday citizen. That
All right, so
have
show us some of these moves. We
Very
want
good.
to check this out.
So we use a foam roller as part of one of our treatment tools, and Jonathan, he is actually one of our practice development managers, but he's going to be my guinea pig today.
Awesome.
And he's going to be rolling out the iliotibial band, which is connected from the hip down to the knee and causes many, many problems in either or the hip or the knee. So what he's doing is basically, we call it the search and destroy mission, and he's looking for any sort of hypersensitive areas in this thick piece of fascial tissue along the leg.
All right.
And that is called a myofascial release in itself with the foam roller.
So this right here is a therapy. So are you...
It's a therapy accessory, if you will, because the first half hour, again, I'll be doing manual therapy, but then our progress really is sent home with the rehab exercises that they do. And this is a mobilization tool for us to continue the progress of getting that fascial wrinkle unwrinkled.
I love it. Now, and I have a foam roller at home. I've done this before, especially when my quads are aching.
Yes, ma'am.
And sometimes I have knee issues, so the foam roller is my friend.
It's a great tool to have. Everybody should have this. If you're, hopefully you're consistently exercising, this is a great tool to have before and after your workouts.
Okay, so what's this one?
Now he's rolling out, we have the glute / piriformis roll here, and a lot of folks will have some tenderness in the glutes, be it if
Sure.
you're stuck confined to a desk, and so the glutes propose a little tenderness back there. So what he's doing is looking around in the glute region to find those not so happy spots and, again, unwrinkle those.
He said not so happy. Is this kind of one of those things that hurts so much but still
Yeah.
feels good?
John Cougar Mellencamp said it best. It hurts so good.
Oh,
Yeah.
I love it. Okay, so any other ones, or is that kind of just...
One more we can do.
Okay, great.
We have the calves. A lot of times
for
folks will
runners.
get, yes, a lot of calf injuries, be it runners or even folks that are walking in the high heels, hint, hint. And so a lot of folks will get some discomforts in their calves, and this is a
Sure.
great way for us to help loosen up the calf prior to doing some strengthening or stretching, depending on what they need.
I think that's great. So is this something you would do like after a workout, not before?
You can't go wrong either way, be it the foam rolling is a great way to help open up the connective tissue environment, which will help your workout become that much more productive, as well as doing it afterwards. You're going to recover faster, and you're going to prevent future injuries from occurring.
So if someone's doing this on a regular basis, how often should they be doing it?
We recommend 1 if not 2 times a day. Now, obviously we are extremely
Wow.
busy, so you know, I always tell my patients that at least you're getting it 1 time a day. That's better than none at all, but we highly recommend at least 1 time a day. And so 1 if not 2 times a day rather. And many of our patients say, you know, I'm glad I started this because I can feel the difference. I feel so much better.
Great. Well, maybe one of these days I'll give it a try. Thank you so much. And to find where the nearest Airrosti Rehab Center is, which also includes Dr. Joey Lowry's in Red Oak, correct?
Right.
Okay. Check out thebroadcasttv.com for a link and a 1-800 number. Make sure you check it out. I think I'm going to. This is going to help me. We'll be right back.
Okay.